In this module, we address two issues, one involving ethics and quality improvement, and the second having to do with leadership. In this particular video, we're going to focus our attention on the critical challenge that many of you will be facing in your practices implementing quality improvement, and that has to do with ethics and in the face of scarce resources. During the past decade, the ministers of health of countries of the European Union both solidified and codified their belief and commitment to universal or near universal health care across their populations. Underscoring the inherent values associated with this commitment, in a statement of 25 health ministers of the EU, they reaffirmed their support of the overarching values, which number three. And the first has to do with universality, meaning that healthcare needs to be universal. Secondly, that there needs to be access to good quality care, quality. And thirdly, that there is equity across all of the healthcare systems. And fourth, there is solidarity. And solidarity, as you well know, has to do with the fact that people have access to the same levels of care. Moreover, the ministers also recognized how the European healthcare systems, albeit different in some ways across the diversity of countries in the EU, are focused on implementing quality improvement, combined with preventive health services and promoting healthy lifestyles as part of an overall effort to assure the healthcare systems are central to the high levels of social protection and make a major contribution to social cohesion and social justice. Again, three very critical values in the EU. In short, every healthcare system across Europe is challenged to maintain high levels of quality medicine regardless of the economic circumstances and obstacles they face. In recent years, the economic base of many countries has eroded, leaving the medical community with the task of delivering healthcare services to all patients, even when resources are scarce. This has left in its wake a significant dilemma balancing the precepts of autonomy, beneficence, and distributive justice. As a result, more and more physicians and hospitals are faced with having to ration care to balance the share of the population covered, the services covered, and the extent to which services are covered. And that brings into question, obviously, many of these values and how they match up against the issue of rationing of healthcare services. Hungary is an excellent case study in that what happens when physicians have to weigh the values of quality versus austerity measures. Funding for general practice in Hungary has been maintained on the same level for 5 straight years since the economic crisis hit the country. It means that doctors are facing tough decisions. For example, can they still afford a nurse and administrative staff to run the practice while the real value of their funding is decreasing rapidly? How would this decision affect the quality and outcomes of their work? And how can you motivate your staff to continue to providing good quality services under these circumstances? In summary, the task of balancing the goals of quality improvement to enhance and continuously improve the quality of care while guarding against the temptation to ration at will is a significant challenge for all of the practitioners. We know that. We believe, however, that there is a tool, and this next tool, a team-oriented or team-focused exercise, will help you and your staff create a solid pathway for success in implementing quality improvement even under austere times. And this is called the force field analysis, and you'll see the diagram up here on the right. For this type of problem, we recommend doing an exercise with your staff to explore both the forces supporting quality improvement in austere times and the forces working against quality improvement initiative. Using this exercise will provide you with the ways to identify and create ideas to overcome internal and external obstacles to improving service systems. This exercise is a force field analysis, as I just mentioned. The diagram here will illustrate how it works. The basic idea is that you will look toward reinforcing those forces in favor of quality improvement, this issue, and work to mediate the forces that work against implementing quality improvement. We will very quickly describe each step in the process to illustrate how easy it is to use and how it will provide you with excellent results. Step 1. Set up in your workspace to allow for either a flip chart, a blackboard, or an easel of some kind that you can capture the ideas that you and your staff create, both forces that are helping the goal and those that are inhibiting the goal. You will want to open the session by telling the group what the overall goal is for coming out of the work session. That is, finding ways to implement quality improvement even in austere times. Remind the group there are no right answers, there are no wrong answers, only ideas that we will explore to further determine what will work best in our practice. Step 2. You want to draw the diagram as you see illustrated here. Display the goal. The goal is implementing quality improvement. Write the words helping forces on the left-hand side, and on the right-hand side write inhibiting forces. Step 3. Put forward the goal or question to give your staff about 5 minutes to write down their ideas for each of these as you see in this particular diagram. So the idea would be that each of the staff members will write down a list of his or her helping forces and those that are inhibiting. It's important to have them do that separately at first, and then you can work with those on a collective basis. One fast way of doing that is to provide them with strips of paper, 2 inches by 14 inches of paper. The ideas can then be taped directly onto the easel or put out on a table that you can work with. Or alternatively, you might ask the group to brainstorm. That is, think about a little light bulb and use the brainstorming process to generate ideas that help you identify both helping and hindering forces. But make sure you capture those on paper, on a flip chart again, or an easel, because you'll be using them later. Ask each person to share one idea in turn. Write those forces on the helping side of the board and keeping going around the group until all the factors have been identified. That's step 4. Give the participants another 5 minutes to write down their inhibiting forces. In step 5, ask each person to share his or her 1 or 2 or more inhibiting forces, and again go around the group until you collect them all. In step 6, the goal is to initiate a directed discussion about the force field, asking the group to sort of step back for a minute, look at what they see. What does it say? And what does it say about the opportunities we have? Because that's going to be really important as we look forward towards the future. And then here are some questions you might want to put to the group just to see if there's anything you want to add to what you've already collected. Are there any factors that are missing? Does the group want to change how forces are listed or characterized? In other words, they may have initially put down something as an inhibiting force, but after thinking about it, they may say, really, let's take that and move it over to the helping force side, and vice versa. There could be some things that are initially thought as positives, things that we can help, but in reality, they are actually obstacles. Can the forces be grouped in common themes? In other words, taking some of these and saying, here's a group that we'll call perhaps administrative issues that are helping forces. Here are some in terms of clinical issues that we might be able to focus on in terms of helping issues. This is important because it now takes a broad array of information and distills it down into 2, 3, 4, or 5 common areas that we can then focus our attention on. And the next thing we want to ask is, what would be the priorities if you made the most of the helping forces? In other words, which can give us the biggest bang for the buck? So as again, stepping back and looking at these, you might want to say, over here in this area, we might be able to take this item and prioritize it as number one, but a clinical item that we've identified down here, we're going to put as number two, and over here, which we had as the administrative helping forces, we might find that as a number three priority. Well, now we've got three very diverse actions that we can translate into positive steps. And I think the other question you want to ask is, which are the greatest and the least difficult inhibiting forces? In other words, how big of challenges are we really facing? Do we have control of them? If we don't have control of them, let's not waste our time trying to overcome them. And then the last question is, given the inhibiting forces that we see, what are some clear actions that we can take that will reduce or mitigate the impact that those inhibiting forces have? Step 8. After the exercise is over, take note of the results. Share success where you see success. Celebrate the fact that the team worked together in coming up with these. And commit to share all of the ideas with others in the practice, and again, you're going to use these later in planning sessions. If space permits, like a lunchroom or a non-patient care room that you're meeting in, leave the sheets that you've collected this information displayed on the wall for the day. It will serve as a helpful reminder of the work and the value of the staff that provided the impact for the work that you did. Remember, the focus of this exercise is to develop and implement actions and/or initiatives that will enable you and your practice team to balance the need for high-quality care equitably distributed across the entire practice population, while recognizing and factoring in the need for being careful and parsimonious in the use of our scarce resources during times of austerity, and avoiding unnecessary rationing of care. As a consequence, you and your staff will be better equipped to ration where you have to with forethought and focus, and not jeopardize on the quality of care. We also recommend follow-up meetings to be held to translate many of the ideas that you've collected into positive actions, setting milestones for measuring success in the future and outlooking goals. In order to help you implement this exercise, we have included a narrative of this video in a document in your online program for this particular module, Module 3. We wish you best wishes and good luck for every success. We know you have the capacity, we know you have the capability, and we know you have the commitment to make it work.